Get over it.
I'm going to check for any fall precautions or contact precautions before entering the room. I'm assessing for any environmental hazards, which there are none. Perform hand hygiene. Good morning, I'm Natalie Evans, and I'll be your student nurse today. How are you?
I'm good.
Good. Could you verify your name and date of birth for me?
My name is Natalie Music, and my birthday is June 20th, 1996.
Great. Could you tell me where you are and what the date is?
I'm at John Tyler Community College Hospital, and it is April 15th, 2016.
Good. Okay. Are you experiencing any pain this morning?
No.
No? Okay, good. So on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain, how would you rate that?
I would rate it as 0.
Okay, good. Okay, so patient appears lying supine, and her facial expression is relaxed, and hearing is intact. Her speech is articulate, fluid, and appropriate. Her skin is expected with her ethnic background. Her skin is also pink, warm, and dry, and her skin trigger is elastic. Do you have any questions for me before I start?
No.
Okay. And so patient is alert and oriented times 3. I'm going to shine this light into your eye. Just look straight at me, okay? Good. Good. So patient's pupils in the right and left eye are 3 millimeters, and they are both reactive. Could you open your mouth and say ah? Okay, so her mucosa is pink and moist and no lesions. Patient is also, her hygiene seems appropriate and well groomed, and her nutritional status seems good. I'm going to assess for your capillary refill, which is about a 1 or a 2, so that's good. I'm going to listen to your lungs, okay?
Okay.
So just breathe normally for me. Okay, take a deep breath. Good. Okay, could you cough for me? Again. Okay, so no sputum is present, so no need for incentive spirometry, but if so, I'd educate the patient on that. Her lung sounds are clear bilaterally and no abnormal sounds are present. Could you lean up for me? So I'm just going to listen to your lungs in the back again. Can you take a deep breath? Again? Good. Okay, so no abnormal breath sounds, and the vesicular breath sounds are heard bilaterally posteriorly. Could you smile for me? Good. So no ptosis or facial drop present, and could you swallow? So patient is able to swallow smoothly, and her speech is articulate and fluent and appropriate. Okay, so now I'm going to listen to your heart sounds, and her breathing is unlabored. Oh, I'm going to listen at the apex first. Good. And so I'm listening at the aortic, pulmonic, mitral, and tricuspid. Good. I'm going to repeat it with the bell. Aortic, pulmonic, mitral, and tricuspid. So her valvular sounds are present, and her rate and rhythm is regular and strong. How are you tolerating your diet well?
I'm tolerating it well.
Okay. I'm sorry. Okay, good. So no concerns regarding that?
No.
When was your last bowel movement? Sorry.
This morning.
Okay, good. How frequent and what is the color, odor, and clarity of your urine?
About 3 to 4 times a day, and it's clear, yellowy, and ammonia smelling.
Okay, good. Okay, so I'm gonna I'll listen to your abdomen.
Okay.
The bowel sounds are present in all 4 quadrants. The bowel sounds are neither hypo or hyperactive, so I'm just going to palpate your abdomen. Just let me know if there's any tenderness anywhere.
Okay. No tenderness.
No tenderness, okay. So no tenderness present. I'm going to check for the IVs if there was any, and check for the fluid rate, and make sure that the IV site is free from any redness or swelling or edema. I'm also going to check for the oxygen source or any oxygen that she is on. Okay, so now I'm going to assess your pulse. Can I see your hand? Okay, so I'm going to assess her radial pulse and her apical pulse at the same time. So now I'm going to feel for your post-tibial pulse. So you bend your knee.
The way you said it,
Okay.
I kind of incorporated both, but make sure that you assess.
So her post-tibial pulse is strong in both the right and left legs. I'm going to check for edema. Good. So there's no pretibial edema in either the right or left legs. Could you push against my hands for me? Good. Pull my fingers. Good. So the upper motor strength and response is intact and strong. Could you push against my hands with your feet? Oh, and pull. Good. And so the lower motor response is intact and strong as well. Can I take off your socks?
Yeah.
Good. Oop. Okay, so I'm assessing for the dorsal pedis pulse, which is present in the right foot, and as well as the left. So I'd assess for any SCDs and make sure that there's no skin breakdown under those, and make sure that her dressings and her drains are have been changed and assessed recently. If not, I would do that. I would assess her skin for any breakdown, which there is none, but I would use a standardized scale for that. Okay, could you do me a favor and get up to the chair? Yes.
And you didn't get speech therapy.
So, and you can go ahead and sit back down. So, patient is able to get up to the chair without any assistance and no assistive devices. She is, her facial expression is relaxed as well. I'm going to put this You're welcome.
So as long as they can communicate.
Okay, and she has no risk for falls. And if she was on bed rest, I would make sure that it has been turned and positioned frequently. And I'm going to put this bed rail up just for your safety. I would make sure that the bed alarm is on if needed. I would also put the call bell within reach. So here's your call bell. You can adjust your bed. I'm actually going to put your bed in the lowest position. Sorry. Okay, that's not gonna work. That's actually your controls. I'm gonna put this in the lowest position. I think it is. Okay, good. And do you have any questions before I'm done?
No, thank you very much.
You're welcome. And I would document the patient had her head to toe assessment and everything went well.
Girl, you got everything.
Do you think so?